What if catching blood cancer early could save your life? This silent threat affects thousands of people each year. But what if we could recognize the warning signs before it's too late? Recent studies have shown a steady rise in blood cancer cases worldwide, making awareness more crucial than ever. The good news is, recognizing these signs early can make all the difference. So, do you know what to look out for? Persistent fatigue, unexplained weight loss, or lingering fevers might be signals your body is trying to send. But there's more to uncover. Join us as we dive into some lesser-known symptoms, backed by cutting-edge research, that could help you spot blood cancer before it's too late. Whether you're looking out for yourself, a loved one, or just want to stay informed, this is a discussion you won't want to miss. Symptom 1. Swollen, painless lymph nodes. One of the first signs you might notice is swollen, painless lymph nodes, especially in areas like the neck, armpits, or groin. You might think it's nothing, just a minor nuisance, but these swollen lymph nodes could be trying to tell you something serious. When these lymph nodes swell without pain, it can indicate blood cancer, particularly lymphoma or leukemia. Lymph nodes are a critical part of your immune system. They act as filters, trapping harmful substances before they can spread throughout your body. But when cancer cells accumulate in these nodes, they disrupt their normal function, causing them to swell. In blood cancers like Hodgkin's and non-Hodgkin lymphoma, abnormal white blood cells known as lymphocytes can build up, leading to swelling. Similarly, in leukemia, abnormal blood cells can cause the lymph nodes, spleen, and liver to enlarge, resulting in swelling in various parts of your body. But here's the important part. Swollen lymph nodes aren't always a sign of cancer. They can also swell due to infections or other benign conditions. However, if the swelling persists for weeks without any signs of infection, it's crucial to take notice. Don't ignore it. Early detection could be the key to managing blood cancer more effectively. Symptom 2. Shortness of breath. Shortness of breath isn't just a symptom of asthma or heart issues. It could also be an early sign of blood cancer. You might think of shortness of breath as a result of physical exertion or allergies, but when it's persistent and unexplained, it's worth paying attention to. Blood cancers can interfere with the body's ability to produce healthy blood cells, leading to anemia, a condition where you don't have enough red blood cells to carry oxygen throughout your body. This lack of oxygen circulation is one of the reasons why people with blood cancer often feel short of breath, even during light activities. A 2023 study published in BMC Cancer revealed that nearly 44% of blood cancer patients reported respiratory symptoms, including shortness of breath, at the time of their diagnosis. And it's not just anemia at play. Some types of blood cancer, like leukemia, can cause the spleen to enlarge, which can press against the lungs, limiting their expansion and further contributing to breathing difficulties. While shortness of breath can have many causes, if it's persistent and unexplained, it's time to consult a healthcare provider. Remember, early detection plays a crucial role in managing blood cancers more effectively. Symptom 3. Persistent fatigue. If you've ever felt exhausted, even after a good night's sleep, you know how draining it can be. But when that fatigue becomes persistent and overwhelming, it might be your body sending you a warning sign. In the case of blood cancer, fatigue can go beyond just being tired. It can be a profound exhaustion that doesn't get better with rest. Blood cancers like leukemia and lymphoma directly impact the body's ability to produce and regulate blood cells. When this process is disrupted, it leads to anemia, where the body lacks enough healthy red blood cells to efficiently carry oxygen throughout the body. This lack of oxygen circulation can result in feeling extremely fatigued, even when you're not doing anything physically demanding. It's important to note that this kind of fatigue is different from regular tiredness. Patients often describe it as a constant feeling of weakness, making even simple tasks feel like a huge effort. A 2023 study published in Scientific Reports revealed that up to 40% of blood cancer patients reported severe fatigue at the time of their diagnosis. If you're dealing with unexplained, persistent fatigue that doesn't improve with rest, it could be time to see a healthcare professional. Fatigue alone might not point to blood cancer, but when combined with other symptoms, it's worth getting checked out. Symptom 4. Night sweats. Imagine waking up in the middle of the night, drenched in sweat even though the room is cool. It's more than just an uncomfortable nuisance. It could be a sign that something deeper is going on. While night sweats can be caused by a variety of factors, when they're persistent and severe, they can point to blood cancer. Blood cancers like leukemia and lymphoma can disrupt your body's ability to regulate temperature. This happens because the cancerous cells interfere with normal immune function, which includes the regulation of body temperature. As a result, people with blood cancer often experience night sweats, intense, soaking sweats that occur regularly, typically during the night. These aren't the kind of sweats you get from a warm room or spicy food. They're much more severe and uncomfortable. A study published in the European Journal of Hematology in 2023 found that night sweats were one of the most common early symptoms reported by lymphoma patients. What makes them stand out is their persistence. Blood cancer-related night sweats often soak through your clothes and sheets, something that just isn't typical with everyday sweating. While night sweats alone aren't a definitive sign of blood cancer, their intensity and regularity, especially when accompanied by other symptoms, should be taken seriously. If you find yourself waking up drenched in sweat regularly, it's time to consult a healthcare professional to get to the bottom of it. Symptom 5. Loss of appetite or nausea. Loss of appetite and nausea, two symptoms we often brush off as temporary discomforts. But when these seemingly minor issues are persistent, they can be a signal from your body about something much more serious, like blood cancer. While these symptoms are common in many less severe conditions, they can play a significant role in the early stages of blood cancer, especially when they become persistent or unexplained. Blood cancers such as leukemia, lymphoma, and myeloma can disrupt your body's ability to process and absorb nutrients. This disruption can lead to a decreased appetite, making it difficult to eat even when you're not feeling sick. A 2019 study published in Intestinal Research highlighted how metabolic changes caused by blood cancer often lead to reduced food intake, contributing to the loss of appetite in patients. Nausea is another symptom that might not raise alarm bells at first, but when linked to blood cancer, it can be more troubling. The nausea often results from an accumulation of waste products in the body. As blood cells function improperly, these waste products build up, triggering the body's nausea response. A study published in BMC Cancer in 2023 confirmed this, showing a direct correlation between waste buildup and nausea in blood cancer patients. If you're dealing with a persistent lack of appetite or nausea that doesn't seem to go away, it's worth consulting a healthcare professional. While these symptoms alone don't point directly to blood cancer, they can be a critical part of the puzzle when combined with other signs. Symptom 6. Itchy skin. Itchy skin might seem like a harmless annoyance, but when it's persistent and unexplained, it could be a sign of something more serious, like blood cancer. You might dismiss it as dry skin or an allergic reaction, but in the context of blood cancer, the cause behind that itch is much more complex. In certain blood cancers like lymphoma or leukemia, abnormal cells can accumulate in the body and release substances that irritate the skin, leading to persistent itching. A 2019 study published in Dermatologic Therapy revealed that nearly 30% of patients with Hodgkin lymphoma experienced intense, unrelenting itching. Unlike regular itching that can be relieved with lotions or antihistamines, this type of itch doesn't seem to go away, no matter what you try. What's more, this itch often appears alongside other symptoms, like unexplained weight loss, fatigue, or night sweats, creating a pattern that shouldn't be ignored. When these symptoms occur together, they might point to a more serious condition than just dry skin. If the itching is persistent and accompanied by other warning signs, it's time to consult a healthcare professional. While itchy skin alone isn't a definitive indicator of blood cancer, it can be an important piece of the puzzle that helps doctors make an early diagnosis. Symptom 7. Unexplained bruising or rashes. Unexplained bruising or rashes might seem like a simple skin issue, but when they appear without a clear cause, they could signal something more serious, like blood cancer. These symptoms often go unnoticed, but they can be an early indication that something is wrong with your blood cells. In blood cancers like leukemia, lymphoma, or myeloma, the bone marrow, the place where your blood cells are produced, can be affected. As the cancer progresses, the bone marrow struggles to produce healthy blood cells, including platelets, which are essential for blood clotting. When platelet production is disrupted, it can result in easy bruising or spontaneous bleeding, often without any apparent injury. Rashes are also common in blood cancer patients, particularly when the immune system is compromised. The cancerous cells interfere with normal immune function, which can cause the body to break out in rashes, or even lead to abnormal blood clotting. A 2023 study published in BMC Cancer found a significant link between unexplained bruising, rashes, and the early stages of blood cancer. If you notice bruising, rashes, or abnormal bleeding that you can't explain, it's crucial to see a healthcare provider. While not every case of bruising or rashes points to cancer, persistent or unexplained symptoms warrant a thorough evaluation. Symptom 8. Frequent infections. Frequent infections might not seem alarming at first, but when they become a regular occurrence, they could be a sign that something is seriously wrong, especially if blood cancer is at play. You might be getting sick more often than usual, or your infections may seem unusually severe or lingering. This could point to a weakened immune system, a hallmark of blood cancer. Blood cancers like leukemia and lymphoma affect the body's ability to produce healthy white blood cells, which are essential for fighting infections. As cancerous cells crowd out the healthy white blood cells in the bone marrow, the body becomes more susceptible to infections, and these infections can be harder to fight off. In fact, a 2021 study published in Hematologica showed that individuals with chronic lymphocytic leukemia often experience more frequent infections because their immune systems are compromised. It's not just the frequency of infections that matters, it's also their severity. If you're noticing that you're getting sick more often, or that your infections are lingering for longer than usual, this could be a warning sign. Add other symptoms like fatigue, unexplained weight loss, or night sweats, and the risk of blood cancer becomes more likely. If you find yourself battling frequent infections that seem out of the ordinary, it's important to consult a healthcare professional. Early detection can make all the difference in managing blood cancer effectively. Symptom 9. Coughing or chest pain. When you think of blood cancer, coughing or chest pain might not be the first symptoms that come to mind. But in some cases, these issues can be linked to serious conditions like leukemia or lymphoma. Coughing and chest pain in the context of blood cancer are usually indirect effects, often caused by the cancer's impact on the lymph nodes or immune system. In certain types of blood cancer, enlarged lymph nodes can press against the lungs or airways, causing persistent coughing or even chest pain. This isn't your typical cough or a minor ache from a cold. It's usually persistent, unexplained, and doesn't seem to have a clear cause. In fact, a study published in Pediatric Surgery in 2012 found that enlarged lymph nodes caused by blood cancer could lead to coughing or chest pain by pressing against the respiratory system. Additionally, blood cancers can weaken the immune system, making the body more vulnerable to infections. These infections can also contribute to symptoms like a persistent cough or chest pain, further complicating the picture. If you're dealing with persistent coughing or chest pain, especially if it's unusual or accompanied by other symptoms like fatigue or unexplained weight loss, it's important to get it checked out. While many things can cause these symptoms, when they're combined with other signs, blood cancer should be considered. As we wrap up today's video, we hope you've gained valuable insights into recognizing the early warning signs of blood cancer. Awareness is the first step toward early detection, and as we've seen, early detection can make all the difference in effectively managing and treating blood cancer. If you found this information helpful, don't forget to subscribe to Health Insight Explorers and share this video with your loved ones. Your support helps us continue spreading awareness and empowering more people with life-saving knowledge. Stay with us for more upcoming content on health, wellness, and the latest advancements in medical research. Together, we can take charge of our health and build a future of informed, proactive well-being. Thank you for watching, and remember, keep learning, stay vigilant, and take care of yourself and those around you. Until next time, stay healthy, stay strong,